Good morning, good afternoon, and good evening, everyone. We're so glad you're with us today. My name is Celia Sandhya Daniels. I am an entrepreneur and a human rights activist. I identify as a non-op trans woman of color. I volunteer for SDIG along with Joseph and the team. I'll be taking your questions today and throughout the session, and we will give our panelists a chance to answer these questions and also in the end of our discussion. I'll also be moderating some of the conversations, especially when your questions come in. I'll be helping Joseph in assisting, making sure that he's capturing all the questions from you. We want to hear your voice. That's so important for us today. So I just want to talk a little bit about Systemic Diversity Group. The Systemic Diversity and Inclusion Group encompasses everyone, regardless of their circumstances or belief. Our purpose is to bring diverse members of our global community to share their experiences, learn, and understand from each other's experiences. We provide a platform for everyone to especially the marginalized community to express themselves on the issues that are so important to them and to this community and also in our country. We have an amazing line of panelists today who are doing meaningful work in changing our community, our country, and across the globe. But before that, I'm pleased to introduce Dr. Joseph Noy, the founder of SDIG and the president of Systemic Diversity and Inclusion Group, to say a few words and also to introduce the panelists today. Dr. Joseph?
Thank you so much, Syria. I appreciate you. I appreciate all the work you have been doing to help in getting us to where we are today. And it's my pleasure to welcome all of you, especially our esteemed panelists. And I just want to say that, we have, as I've always stated, we have a systemic problem. And the systemic problem we have requires systemic solution. Therefore, that's the purpose of our getting this, so that we can unite all the problem, unite all of us to fight for equity in all its forms, whether it's gender, race, or any other aspects of the isms. The idea is to foster equity and social justice. So it's my pleasure to welcome these esteemed leaders. And I would also say that there are 3 sessions to this. The first session will be for the panelists to answer the questions. And after that, there may be follow-up questions depending on time. And when you are responding, please try to keep it under 3 minutes for each question. If it goes to 4, that will be understandable, but please do not go beyond 4 minutes. So it's now my honor to welcome these esteemed leaders. First is Marinda Rapalda. Second is Christiana Taft. Third is Malaika Semon. And fourth is Future Kane. They are all in their various status doing wonderful things. But what I will do now is to have you introduce yourself, discuss what you do, how what you do aligns with the work we do at SDIG, and then how you look at future work. So let's begin with Miranda.
Hi, thank you so much for having me. I'm so excited to be part of this conversation with all of you today. So I am a mom first and foremost, and what I'm doing is raising awareness of the maternity crisis that we have here in the United States, and I'm forming a task force to really delve into this conversation in more depth and and take a look at how that is also being impacted when it comes to the color of somebody's skin in that space as well. So that's what I am doing right now. Joseph, I feel like there was another piece to that question, how it aligns with the work that the organization is doing. It's really, I'm looking for how we can make a difference in this space, which is exactly what SDIG is doing, is how do we make an impact for people of color, for women across the board, women who are marginalized, women who are dealing with problems because of where they are, because of the color of their skin.
Thank you very much. And we are going to Christiana. Christiana, you need to, tell us more. I see the wonderful work you do, and I kind of looking at your work from global perspective. I thought that has been really drawing my attention to the work you do, and I'm very pleased with all you do. Could you elaborate on the same question?
Right, thank you. So I'm the founder and CEO of Worldy, which I'm trying to create social media for good. But also I worked on trying to do some public safety projects. So after the fire happened in Paradise in 2018, which burned down the town, I then started trying to like push for technology and public safety. And so like real-time data, location, demographics, and more high tech to get involved, because right now, although you can see like a rideshare or food delivery come in real time, you can't see responders. And that also creates a lot of problems where it's not victim centered, it's not proactive or preemptive. And so I work on bringing together people in public safety tech around the world to like chat with each other and collaborate. So I have a chat called like Rescue Alliance, and trying to get them speaking to each other. And of course, it really shows like our focuses are like, victims or like fires or women like experience domestic abuse. There's like no technology for that. And then also it also affects founders that are people of, African descent. Like Eric Fitzgerald of Eden, when I try to do that project, he's of African descent. And so you start to see you see a pattern of people that are leading these projects are often like women or minorities and things like that, or they're, they experience these disasters as victims, or, firefighters like Nico of Save Me Now app is a firefighter who saw it. So you start to see patterns of like, these are different people from other sides of the problem trying to fix it. And then with the online social media space, there's a lot of discrimination against women online, and that's really harmful to even get to hear them or anything. So I don't know if you watched the Amber Heard case, but even though the UK said she was valid, it's been for 2 years and constant death threats every single day. And so I researched that, and I also researched because of witnesses. So also case examples and data training is very important. So what they're looking at for their training, and then also what their policies are, is actually really influential.
Thank you so much, and continue the good work. It's a lonesome work, but it's a good work. Malika Simmons is somebody who had she has traveled so much, and she's like, she amazed me by the description of the places she had been and how those things had influenced her. Talk about being aware. A lot of people are not aware of many things, but they make decisions on those things they know little or nothing about. And we see a lot of that in this country. But I have to move to Malika. Could you please respond to the same question?
Yes, thank you. Good morning, and thank you for having me. I am Malika Simmons. That's Malika, like I like a Malika. and I work at the intersection of women's empowerment and empathy. I truly believe that humanity is best served by being empathetic to all, and that's where equity comes in. I'm the COO for the National Alliance Against Disparities in Patient Health. We are the lead for the National Institute of Minorities in Health and Health Disparities for congressional appropriations to drive awareness to disparities in patient health, access to care, health equity, that sort of thing. I also am an author and a speaker, and I am the creator of the Momentology method. Momentology is a study and practice, emphasis on the practice of operating in the now, succeeding with what you have right now in this moment. So I have a mission to empower 1,000 women to empower 1,000 women globally. And so all of my many somewhat seemingly disparate things all have one through line, and that is the empathetic view of the world. And in my opinion, women are at a very special position in which to achieve that. So that's me in a nutshell. Thank you again for having me.
You're welcome. Now we're gonna go to Future Kane. Future Kane, her story really touched me. She happened to be from the state where I went to school. So we have had common discussions as to our varied experiences. So I'm gonna bring her in to answer the same questions as to what she does. And now she has a more prominent job. And I believe that with that prominency, his expectation will be going up, and we hope that she will be equal to the task. So, Future is your floor.
Good morning, everyone. Good afternoon and good evening. My name is Future Kane, and I am the CEO and founder of the Future of SEL. And what that is I founded that in the wake of the civil unrest that was happening to help the intersectionality and to help people be understanding and accepting and uplifting to every ism. And what my primary focus is on doing is we have to start at the root cause. And with racism, for any ism, it's taught. And I want to get at the root cause, and the root cause starts with children. So that is my primary focus. In addition, I currently hold the position of statewide project coordinator for multi-level systems, for implementing multi-level systems of support and trauma-sensitive mental health and social-emotional learning for our entire state with public and private schools. And we go into schools and we help coach. In addition to that, I am on the forefront and I'm very active with fighting for equality, and especially for race and the opportunity gaps and the damage, I would say, in regards to our mental health and well-being that is being done to people, and more specifically Black people, and every ism. So that is why I'm here today, because gender equity is a big piece of that. In addition, it aligns because the core values of SDIG are respect and open communication, and equality is a right, and not everybody is demonstrating that. But yet we're here today coming to have an open conversation and respecting each other's point of views so that we can move this work forward, because we are truly all in this together. And the sooner people can sit with themselves, we can move this work forward.
Thank you, thank you, thank you to all of you. It's fitting here for me as a guy having to moderate women discussion. It reminds me of a time when I watched 99 senators talking about women reproduction, and I'm like, wow, there was no woman in that particular session. So I feel much better because I have women here engaging in women issues. So I wouldn't say it's only men talking about things they don't know about. I know the list. I have to concede to that. But I want to go back to history. Just a couple of months, we lost a legend that some label as, the notorious RBG, somebody who quietly had done so much that is clear. Some people may know her, some people may not know her. I'm talking about Ruth Bader Ginsburg, who was one of the justices. And, from her years at ACLU through her decades on the bench, Ms. Ginsburg brought about a revolution in gender discrimination. And it wasn't just for women. She used her tactical approach to shed light and to fight for principled position, equity for all genders. She defended the men as well as women. When she finished her school, law school, and so on, they gave people who didn't obtain the kind of degree she had. She was first class, if you want to use that term, and yet she couldn't get a job. From her years in ASLU through the decades of all the work she did on the bench, she clearly brought a revolution in gender discrimination. Becoming a woman, people tend to equate her like Thurman Good Marshall, former judge, what he was for African Americans. A lot of people see the notorious RBG as representing women in the way former Justice Marshall represented African Americans. And in this situation, we have to be working hard, fighting hard. What I would say to the ladies, I hope you don't see it as negative, but I try to be clear as to what I believe. And if I do go wrong, please correct me, then I can learn more. So on that note, I call on you to reflect on her, reflect on how you're trying to plan, strategize, and more importantly, don't try to do it alone. We have other issues. And again, when I say systemic, I meant to say we have racial problems, we have gender issues, we have people's sexual orientation. It shouldn't be the criteria for determining whether the person lives or doesn't live. We have all kinds of isms, and it will take all of us, all of you, to infuse that synergy, the talents, to fight against inequity in all its forms, to a point where everybody will feel fairly treated. That should be our goal, the goal for all decent human beings. So from that standpoint, I want to pose one more question for you, or rather to you. And the question would be, looking at your position at this particular moment, looking at all avenues through which you can deal with issues, what would be your mark to ensure that your legacy is sustained or maintained, just like the notorious RBG? That is reflecting on your work, how you're gonna strategize in order to get the best result, and how you see the future. Miranda.
Well, thank you for the question. In the space of maternity, I see a really big opportunity to educate our young girls about themselves, about their bodies in a way that that they honor themselves and honor other girls' bodies as well in the process, and to learn how to advocate for themselves with their healthcare providers. They can have conversations to make sure that they are well informed and making the right calls for themselves. So if I could leave a legacy, I think that that would be the biggest one, because they are our future. And those are the girls that will grow up to be leaders, to be spouses, to be mothers, to be friends. And I think that that would make a tremendous difference in this space.
Thank you very much. Christiana, the same question.
So the question is how we're making a long-lasting difference. So obviously in this space, although the platform Social Media for Good really is small, we still had like over 60 people support or team members. So it is creating a long-lasting difference even if we don't have users. So just, presenting it out.
Christina, your mic is, we're not able to hear you. If you don't mind, I think.
Yeah, okay. Can she see you or?
Yeah. Christina, can you go again?
I think she's still muted.
It is, you can unmute yourself. I think there's some.
Who, me?
Yeah, we can hear you now. Please go ahead.
Yeah, we can hear you now. Okay, sorry.
Okay.
The
I
last,
was just going
the
over
last
that.
10 seconds of your conversation we couldn't hear, but we could hear till then.
Oh, okay, thank you. But yeah, so there might be a pilot project finally in the US for that. And so I talked to a lot of people like in Europe or other countries internationally, and so they have a lot more public safety tech. And so he's coming from Spain and might come to Paradise and provide that technology. So then you could see, provide the location and the map of and the data of where the victim is. And so just talking to victims on an equal level that he does, and also getting us involved with it to oversee and provide experience is very important, because this whole time on the public safety side, they've totally ignored victims or like what their perspectives is. So it's very innovative. And so that's creating long-term difference to try to get it implemented. As soon as it starts, then it's like, well, now we're finally moving on. And then also with the social media space, I'm still picking away at that, and people, they do get the ideas over time. So, thank you.
Thank you. And Ken, Ms. Ken, the same question.
Okay, I already know what my legacy is, and I've talked to my husband, and regardless of how tiring it is, I will continue on this fight until I leave this planet. So my legacy is equity. And while at the center of that is race equity, I know that it hits every ism too, because this fight is for every ism and every ist. And the legacy that I believe will help and that I will leave is that by putting this into children's schools, and not even K through 12, starting as early as early childhood centers, second graders, third graders, because it's been proven that bias is shown by the age of 3. So if we can go in and help them understand the importance of social emotional learning and mental health, we will then flourish a whole child who feels seen, who feels heard, who feels valued, and they will do that for others, to then increase our academics, to decrease the discipline, but to increase humanity so that we have a better world to live in. That is my legacy.
Thank you. Malaika, the same question to you.
Thank you. Well, to quote RBG, women belong in all the places where decisions are made, right? So all issues are women's issues. I believe that my personal impact is related to promoting empathetic critical thinking and awareness. And so one of the things that I find, we are so busy being exceptional in this country that we forget how connected we are. And we think we are exceptional, so we think that we are singular. And so our downfall is that singularity. And so I'm hoping to promote more empathetic connectedness between humans. And so I think that my impact will be leveraging what is for the betterment of everyone, right? So it's not just kumbaya, let's just pretend that things are wonderful, but let's be aware of where we are, where we stand in our space, as well as how other people stand. In the movie Avatar, they had the saying, a greeting that literally meant "I see you." In the Zulu tribe, Sawubona means "I see you." People are just not seen, and I think that is the leading legacy that we all can have, is where we help other people to feel seen and to feel heard.
Thank you so much. I think everybody can see the kind of people that are here. And to that end, that let's assume that the president-elect, Joe Biden, sees the caliber of people here and decides to call on you, saying things along the line that we know the history. We know where we are at this point in time. But I want my administration to end all kinds of discriminatory practices. And for seeing you, and he says, well, this is a woman that really understands. Not only that she understands history, she knows where she is, and she knows where she's taking us to, based on what you had indicated. And calls on you and said, could you come and help me? So in 4 years, all these issues will be dealt with and put an end to, as we see equity and social justice for all taking shape. And then if she calls you and says such a thing, Miranda, how would you, well, to all of you, how would you use the opportunity or the platform to advance the issue of gender equity? Miranda?
Yes. Well, at the end of the day, all of these things lie in conversation, right? All of these biases that are being held by me and by you, it all exists in conversation and perspective. And the thing that's going to move the conversation forward is to broaden our perspective. And I love what Malaika was saying about having empathy. If we see each other as human beings, not as the other side, not as the person we disagree with, it really opens up the dialogue that can move us forward toward a world that's better for everybody. So if I were tasked with leading that, it sounds a little cliche to use the word education yet again for that, but I really do believe that educating one another is paramount. And having real conversations to get to know the humanity in somebody that you disagree with, and to start to unpack your own biases and that of other people would be really critical here. So I think that for me, it would be to start arranging those kinds of conversations. And again, working on that with young people, because biases do start so young.
Thank you so much. The same question to Christiana.
Great, thank you. I would definitely tell them that they need to remove discrimination online and in technology. So we see a lot of hate crimes online and harassment and threats, and that's because they don't have laws or policies against discrimination on the internet. I think they need to move away from calling it speech to calling it environment and livability related, so that we don't just keep going in a cycle of, fundamentalism, like Bill of Rights or this and that, internet or incited, or it's people pushing their agendas, or harassing people. That is not, having to do with speech. That's having to do with livability, environment, and discrimination. And the fact that they don't have any discrimination laws or policies for internet technology is an action they need to take, and to take control over what's happening to people to protect their lives, their careers, and livelihoods, and then also to stop crimes and abuses on the internet. I also think that they need to work on public safety to connect victims to the management side, and also to remove the discrimination that's in there, because when they're not taking the data, then, you know, as we've had these protests, they're not looking at how they're not connecting data to the front line. And so because of them not getting that information, then they're allowed to do nefarious activities or go off their safety patrol or not even go to people. So like you can't even type in information to 911 systems, or you can't provide reports on the internet. And so it just lets them choose what they want to look at and then choose what they want to, because they're not collecting the information, so then they can put anything they want in there basically. And so then you can't even find victims, and most people think it's a TV show like NCIS. They can just find people, and that's not at all what's happening. And it's very, you know, horrible that you both cannot talk about it on the internet because you'll get attacked. And then you also can't even defend people that are getting harassed on the internet. You can't do anything because it's systemically built to not allow you to help other people.
Thank you so much. And
Joseph, there is one question. Do you want me to bring it up now or later?
Yeah, well, as soon as they finish this go around, then you can bring that one up. Ms. Kane, the same question to you.
Ooh, I have a lot to say. Okay. So one of the quotes is, behind every strong man is a stronger woman, right? So we have to look at the data, and the data is glaring in our faces. And in all the systems that we see majority of men are leaders and what we would say considered in power. So I think that needs to be looked at, because we're not going to be able to dismantle anything if we can't get to the system itself. So the men have to be open and vulnerable and courageous enough to sit there and say, you know what, women and all gender identities have a lot to offer and can help us move every single work forward. So that would be one. The other thing, in order for you to be able to get there, it goes on what Miranda said. As people, and I keep pushing this, you have to have your own self-awareness. And in order to have a self-awareness, it's painful. And I tell people that ignorance isn't bliss, knowledge is painful. And people have been sitting with their conscious or subconscious, and they're not comfortable with what has been taking place. I also tell people that we are Houdinis of feeling through our emotions, because many of us are choosing to escape by avoidance instead of sitting with ourselves and feeling through what we need to feel. Because the reality is, what you resist will persist. And this is why we're at where we're at. So if people could actually sit with themselves and then say, I see a new perspective, I understand myself, to have a vulnerable, courageous conversation, then we could work towards dismantling all the systems. So I think it's bringing more people to the table, because you're going to create algorithms, like Christina said. You're going to keep creating the same systems that are status quo, that we say, oh, why isn't the problem fixed? But you didn't bring new perspectives and new views to the table. So we need more people to be heard. And those people are us, right? We're all sitting before you. So we have to have different people with different solutions, because the solutions that people are bringing forth aren't helping. They're actually causing trauma to a lot of people in the community.
Thank you. I think thus far what had consistently come out from each and every one of you reminds me of a home girl, Ngozi, who had written and spoken extensively about the danger of a single story. And if we would pay attention and engage with one another, perhaps we will be coming up with better story. And I think it's fitting at this point to, I would have liked to go to Celia, because I think she's always coming with brilliant questions that could probably tie into this. But before we get to that, let's go to Malaika. Malaika, the same question.
Thank you. So you can't legislate kindness, right? All of the policies and the laws in the world are not fundamentally going to do anything about the heart of man. There has to be programs. There has to be incentives. Humans are by nature selfish creatures, right? And so empathy is actually a selfish endeavor. Empathy builds shared interests. Like sympathy is, I feel sorry that that's happening to you, period. Empathy is, I feel you. And I think Celia had pointed that out earlier, right? Not just I see you, but I feel you. So sympathy is, I feel sorry that that is going on in your life, or I feel sorry for you. Whereas empathy is, I feel how that can affect you. And then therefore I'm now feeling it too. And now I want it solved, right? So we didn't get to the point of resolution or wanting resolution until we were in concurrence with the feeling. In maritime navigation, there's a concept called dead reckoning, which means if you start from someplace unknown and try to navigate to a secondary point, you'll be off if you don't know what the point is. You have to know and be in agreement upon what the initial point is before you can move forward. So in order for us to solve, we gotta solve what the problem actually is, which is driven by empathy. So I'm going to continue to kind of beat the empathy drum because I feel like that's where the starting point is. We will be at a dead reckoning in every solution that we come up with if it is not imbued with a sense of empathy and acknowledgement and some level of concurrence, not consensus, but some level of concurrence around what the problem is. We're not going to get anywhere. So.
Thank you. And this point, Celia, can you come with your question and, look at the questions they may have on the board?
Yeah, absolutely, Joseph. There's a question from Karen. What Karen has asked is, I would love to know the experience of the panel with the training and education of preventive measures within the education system when it comes to healthy relationships. And Karen also has added that she had done some volunteer work back in 2009 to 2013 with some community groups to do some prevention and education on healthy relationships. But she had learned a lot personally, but she would love to hear from each one of you as a panelist in terms of the education and preventive measures when it comes to healthy relationships in the education system.
Do you want me to go first?
Anyone can, yeah, go ahead.
I can go first. Hi, Karen. Thanks so much for your question. So first, I would like to say some of us are moms on here, right? And I think the education of educating our children who are going to the educational centers begins with us as parents and guardians. So I would say first and foremost, I like to say I'm a mom of two. I have two elementary school children. I have a boy, which is scary right now. And I also have a daughter. So I think that's one perspective that I bring. I also am a product both of private but public school education system. So I have sat through and I could say what I've personally experienced and what I wanted to improve on, which is even why I went for my education background. So I guess I'll give you my educational background, which is going to be helpful, even though I don't believe in titles. I have a bachelor's in psychology. I have a bachelor's in speech communications. I was then working in a field with children who primarily had autism and other behaviors that are on the DSM-V diagnosis scale. And when I was going into the public schools, I saw there was a disservice being done to the children. And I was angered by it. And I said, what can I do at the center where I was working? And they said, well, you have to go back for your master's. I said, this is a bunch of BS, to be honest, right? Like I can't help unless I go back for my degree when you see what's going on in the school. So I went back for my master's in special education. And then I said, I'm going to create the classroom where the children are seen, heard, and valued. And I'm going to put mental health into the classroom, and I'm going to bring social emotional learning into the classroom. So I did that for years. And then I worked my way up to leadership positions. I have been an assistant principal at a high school. I have been at the director level. I was past director of social emotional learning for a school district. And I am currently at the state level doing exactly what you're asking and working in regards to the mental health and in regards to social emotional learning. I think the other piece that I bring to all of this is I'm technically a certified yoga instructor, and the yoga instructor training, it's a 200-hour training that I went through. We learned about trauma-informed care and social emotional learning and how to weave that in. And there's science behind yoga, and I practice it, and I've been practicing it for years. And it has helped me become a new being. And I know the impact it's had on my children, and I know the impact that it could have on others. And that's why I created the Future of SEL, because all of those pieces woven together will create new beings. And that's what I want to do. So I'm hoping that gives you a better understanding. You could reach out to me at any time if you have questions.
Yeah, and it was hard to put all the context in the chat. Just to give you some context behind my question was I felt like I learned a lot of just volunteering and going into kind of high schools and colleges and talking about healthy relationships. And one of the things that we mentioned when I was volunteering with some of the community services was that, we teach our children so much about, safety in terms of, wear your seatbelts, look both ways before you cross the street. But we don't even teach them how to have healthy relationships, that you have the right to change your mind. You have the right, to, just like basic relationship rights, and that people don't need to go through your phone. Those are your rights. And when you get in a relationship, those are controlling things of power and influence, and just so things that we were working on with young teens, and even in the college environment, it was just like really enlightening for me as a young adult that I was never taught those things either, and I was just wondering if you guys have come across any of that, and the work that you do, just in terms of learning healthy relationships and being able to pass that on.
So one thing, so I agree with what Future was saying wholeheartedly, partly, and especially around the advocacy, like having to become your own advocate. So raising a child that had pervasive developmental disorder, which is on the autism spectrum, I had my share of IEP plans and 504 plans and accommodation discussions and all sorts of things. And that's just one part of it, right? That's just trying to figure out what's the best thing. And I too have a bachelor's in psychology, so at least I had some starting off point. A lot of parents don't have that. Well, now I say a lot, but some people don't have that. And so they're not quite sure how to be advocates for their children. But to your point, Karen, around the things that we teach our children, again, I would dovetail into what Future said in terms of starting at home. So having 5 boys and a girl, my daughter is the youngest, and I would say that she has the boot camp for her learning how she should interact with male. She has a father and 5 brothers who have taught her and helped to mold for her, what true love and affection looks like and what respect looks like. And so again, some people don't have that. And so my encouragement and what I take out with me, I've done courses and work with elementary schools at times, is learning how to respect boundaries, like you said, teaching children about self-awareness, teaching children that they have the power and autonomy and agency, especially girls, teaching them that they have full agency of their own bodies, of their own thoughts, and promoting that. So I do see it as a continuous problem. And the way that I look at it is I want every little girl to have a semblance of what I believe my daughter has in that ability. She is very self-aware, very self-assured. And I mean, she kind of came into the world like that, but she also was buoyed by affection and respect from male counterparts, and both in her immediate circle. And she demands that even at 11 years old at this point from other people.
Karen, can I ask you a question?
Yeah, absolutely. Go ahead.
Do you have children?
Yeah, I have 3.
Okay.
all different ages. So I think 8, 12, and 17. So
Okay, so here's what I'm going to tell you. And you could direct message me. I'm on LinkedIn and Instagram. You need, as a parent, right? We have to advocate for our children too. And there's questions that I will help you personally walk through that you should be asking your school. Because as the former director of social emotional learning at my school district, that was embedded, right? We helped and we said, this is valued, especially in the wake of COVID, this has to be in the classrooms. So then I would push on your school district where your children are going to say, how are you embedding this into the curriculum? Because it's not a period, right? It's not a class 15-minute period. It should be woven in that whole entire school day, especially in the middle of a pandemic and civil unrest. So if you need, you talk to me and I will give you ideas and suggestions.
sure, thanks.
Future Kane, can you put your information there so Karen can get in touch with you, and all of you can do that as well. Christina, I know you had some experience, especially working on the platforms to create such an awareness. And I've been personally, looking at some of the information, you've been doing across the globe. Can you share about the education that really brings this kind of healthy relationships from your end?
Right. So another partner that we have with Worldy is like Peace Education and Practice Network, and
I think your signal is really weak, Christina.
Mm.
Or it's just me, or it's Christina?
I think it's weak.
Can you hear me now?
Yeah, I can hear you now. Go ahead, please.
Sorry, my internet's unstable. But because of creating more collaboration on the internet and choosing to focus on helping people versus just reporting them, like flipping the view of what social media could be, that creates, more, supportive relationships that really support people and that they work together. So if people go on there, they're less likely to be negative or to fight with other people, and that's very important because we see with these platforms today, they're run on advertising and engagement. And so they create it more and more like a gamer culture. And we take the view that we can look at it as a video game, but it's environment, so we can create it better. And that is important to provide social impact versus what's happening now with how it's ruining people's lives. And that is very important for creating supportive relationships and that benefit people successfully to create success and to make people feel more empowered is important. And that's very difficult to do. It's taking a long time to evolve, but we are supported obviously by Peace Builders because it does provide that collaboration.
Yeah, thank you, Christina. And I think it's so important for us to keep educating, and that's one of the most important ones, especially when I know, Miranda, we had chatted a little bit earlier last week about so many issues, and one of the things that you mentioned today in our call is about the how do you educate young women, how to treat their bodies right. And there's so much that sometimes people don't feel comfortable in their own bodies because of, there's so much of perception, even in the social media, when people kind of abuse how you look. And, how do you, in your experience, just wanted to hear from you, Miranda, as to, have you come across situations where you have emphasized the fact of how they should respect themselves as well and build these kind of healthy education system within the school governing boards?
Thank you, Celia. I have not worked in the schools directly at this point. My primary work up until now has really been with any and every mom to be and postpartum mom that I've come across, because we have this birth culture of that's just an extension of our relationship and our culture around how we view women, how we treat women, how we interact with women. there is a lack of appreciation and respect and honor for our own bodies, and therefore the way that we treat someone else. There's judgment there, and there's that at play. So what I've seen in my experience is women going into situations with healthcare providers who are supposed to be there, and they trust these people to be there and to have their best interest at heart. But what's happening in healthcare for maternity is that's not the case, and women are going through some pretty awful situations because they simply trust that provider, because they don't know to ask more questions or what questions to ask to understand what's really going on, to understand the options, to understand what the healthcare provider is telling them they should do. And then you throw in that between if a doctor is advising a white woman versus a woman of color, that's not always the same response given, even if the symptoms and the issues being dealt with are exactly the same. So we have disparity there too. So I'm really passionate about educating women, and particularly young girls, but on the whole age spectrum, to understand that you always have the right to ask those questions, and should, because it helps to change that provider-patient relationship as well. It's educating to the provider as well as to the patient.
And I would also say there's an element of a supposed silence that women are supposed to have, right? So that also further exacerbates the situation. So any day of the week, you can turn on the TV and see a Viagra commercial, and certain men's health issues are prominent and displayed and all of that. And then when it comes to tampon commercials, or like there's a huge disparity in women having access to female hygiene products all over the world, and it's not really talked about, right? These are things that are basics for them, like basics of life, and we can't have a discussion about it. So the fact that women are supposed to quietly be women in a corner is also part of the problem. The reason why we don't have agency, the reason why we are not empowered to speak up about our things, is because we've been told for so very long that we're supposed to quietly deal with it behind a closed door somewhere. And so the more we do to bring women's issues to the forefront, those that are uncomfortable at times for some people, and I think that whole conversation you said earlier, I completely agree. We have to have these conversations. We have to let women, especially young girls, know that there's nothing to be ashamed of, that their bodies are they don't have to be ashamed of, that their voices, they don't have to keep quiet. And so the whole kind of notion that women should be sometimes seen and not heard, just like, that thing that children should be seen and not heard, like this whole thing about who gets to decide who's allowed to speak and when and for how long and for it, to what level, is part of the problem. And so if we're not allowed to speak, or if we feel like we should probably be speaking in whispered tones, that is going to exacerbate the problem.
I'm going to add a shout out to Scotland, which is so comical. They're actually giving free tampons and pads. They've passed a bill that they could get it for free, because they're expensive. If you think about it, there's a lot of people who can't afford to buy them, but yet it's sanitary, right? It's a health issue. So Scotland, so I'm hoping other countries may follow suit. Don't know, but I want to put that out there and say thank you, Scotland.
Yeah.
There is another, I'm sorry, Malika, were you saying something?
No, I was just going to agree. So there's several issues, right? From sanitary products to birth control to, anything that has to deal with women's health and things. We're supposed to just be very quiet about them, and maybe they'll get around to letting us have the, the audacity of being able to be a woman is just remarkable in this world. But yeah, that's all I was going to say. I was just agreeing with Future.
Yeah, and on a peer-to-peer level, there's that interaction, and then let's add in authority figures or supposed authority figures, and that just takes it to a whole other level.
Right. So Lydia had brought a great point, and Lydia mentioned that how do you interpret the strong Black mother narrative when they think that it's more of they think it ends up hurting moms who feel like they can't ask for help when they're struggling. Lydia, would you care to elaborate a little bit? I know you can, I know I probably resonated what you said, but it'll be great if you can elaborate a little bit.
Sure. I would just ask how, as a whole, you would address thinking about, oftentimes I think Black women feel like the perception is they need to put on this strong Black woman, strong Black mother facade, and feel like when they are struggling, they can't ask for help because then it's interpreted as weak or as I'm failing because I'm not meeting this standard of just put your head down and bear through it and act like everything is fine. So particularly for those who are moms that have kids, how you talking about how your education starts at home, how you then express and show your kids that it's okay to ask for help and how you ask for help and how that in turn is being strong as opposed to you feeling like you have to go about it on your own.
Okay, I'll go. Guys, I was this person, okay? I was this person of, it didn't matter if I had to work my full-time job and then come home and work 5 more hours after the kids went to bed and then work on the weekends, and I will do it crying, pushing through, and I'm not going to help anybody. I mean, I'm not going to ask anybody for help. And yoga brought me a new sense of my own awareness. And I said, it's a weakness for me not to ask for help. It's a weakness. And I said, okay, I have to be, if I know better, I have to do better now. And I have to show my children that. So I sat with myself enough to say that isn't the issue. The narrative, right? One, it's a narrative, the angry Black woman, or these are all narratives that, again, I'll say I have to bear, but I didn't create them. They weren't created by me. So I think that's one. We have to get out of our own way. And in order to get out of your own way, you have to sit with yourself. And I don't know how long it's going to take because everybody's on their own journey, and you might have to sit with yourself continuously to get the narratives out there, because I think people forget, if you know the science of well-being, our mind is more powerful than we know and we believe. So what are the affirmations that you're telling yourself? I am strong when I ask other people for help. I am strong when I sit in peace. So those are the things that you have to show your children too. So when when I'm going through struggles, I say, mommy's having a hard time right now. Please let me sit and take a couple deep breaths. Would you like to take a couple deep breaths with me? Or please let me sit. I'm going to give 5 minutes to myself to meditate because I have to step away from this situation. So the kids need skills. For me, just to do it and then not to teach doesn't do anything for my child. So I am talking out loud and teaching them because I want them to have skills. At the end of the day, that's what we want our children to have. We want our children to have the resources, not us. I love my children and I will help and support them when they're 80 if I'm on this planet still. But I want them to be able to be resourceful, problem solve, critical thinkers themselves. And the way that I do that as a parent is I show them and I give them the skills that they are needed to be powerful and thriving when I'm not here with them to make great decisions.
Thank you, Future. Malika, do you want to add anything, or we can move to the next question that I have?
I would just say that persona is sometimes exacerbated in the church and in religious circles, right? Because with women of color, a lot of women of color, the church and that sort of thing is very important, and we're told that it's all about stories. It's stories that you believe, it's stories that you adopt for yourself. And so if you adopt the story that you have to be the strong one, you have to be the one that, is the nurturer, or whatever these Future made a mention of titles, right? These titles that people give us a lot of times. So, if you're in a grocery store and a kid yells mom, if you're a mom, you're probably going to look around, right? How many times have we done it? So, that you identify with certain things, and maybe that strong woman, strong Black woman is one of the things, but I always try to get people to understand, especially women of color, that yes, you cannot be all the things to all the people all the time. That does not take away from your ability to be powerful, from your ability to stand in conviction, for your ability to take care of your children. I agree with Future in terms of teaching the way that you are, right? So in the same way that I might need a minute or 20, like I take 20 minutes for meditation, and it's non-negotiable. And my family knows it is non-negotiable. If you can go to the bathroom, you can give me 20 minutes so I can meditate. And so that's something that is, those boundaries are set up in my family. And so they understand it, but I don't just hold them for myself. I hold space for my kids. If my son and my daughter are fighting and they, I let them have their legitimate problems, as long as they're respectful, but I let them have their time. So I'm teaching them how to treat others and how to treat themselves, and to always give themselves the ability to feel. And so that, I think, we're talking about several different things around it, but I think that the importance of both empathy, again, understanding how other people are feeling, but also having kindness for yourself and giving yourself and allowing yourself time to do whatever it is you need to do. You cannot, resistance is futile, and not to Star Trekkies out there, resistance is futile. What you resist does persist. And so if you have allowance and kind of build in time for allowance of whatever the thing is, I think that goes a long way to help with all of those stereotypes of who you're supposed to be.
I want to add one more thing, Karen. Now, why we are going to talk to us as women, right? I have a boy, and Malika, you have boys in your house too, right? It also starts with, it's not just about me. It's not just about, the gender identity of the female or the girls. It also begins with educating our boys, right?
Absolutely.
This is a game for everybody. So we also have to remember, while we're educating our girls, we have to educate our sons of what it is, right? And to accept and to love and to feel through your emotions, because this is part of the problem too. Because it starts early. It starts early with our books, with our toys, with what the children see on TV. So if we're not teaching them something other than what they are seeing, how do we expect them to believe then?
Thank you, Future. That is a great question from Mike. And I know Miranda was answering that question, but let me just read that question. Mike, you can unmute your mic and maybe ask that question, because I think it's really important for us to have that conversation. I want to hear from Christina as well, but Miranda, would you like to answer Mike's question? And Mike, first, please let us know what your question is. I would like to hear from you rather than reading it out from here.
Okay, thank you for this discussion. It's fascinating. I'm learning a lot. So I'm really curious regarding the treatment or mistreatment, the disparate treatment by medical professionals of their patients. And I was wondering whether or not this is due to the race of the medical professional. And I was informed that no, it's across the board. And so then my question is, well, where is this mindset coming from medical professionals who are trained to treat and help and cure, if possible, their patients? Where's this mindset coming from that some patients are valued more than other patients and deserve better treatment than other patients? Where's this mindset coming from? And so I asked, is it coming from the upstream in the training process of the medical professionals that's causing these downstream disparities?
Yeah, that's such a great question, Mike. And, I would say that the mindset is a pre-existing condition to being a physician, to being a provider. So it's not something that was trained into them, that they were doing, that the training was, causing them to do it one way or the other. I think that there's a lack of empathy, lack of understanding, lack of cultural understanding, social understanding. And Kimberly Seals-Allers has done some fantastic research around this. She's the founder of an app called Earth, which is birth, but drop the B for bias. And the app is essentially a Yelp for women of color, by women of color with regards to their maternity health care. And so, you know, if you're interested in really digging into this a little bit more, I really strongly encourage you to check out her work, and I'll put her information in this chat. But you point to something really important, which is that this isn't just a, well, they're giving they're limiting their healthcare options for that person because the provider is white, because the patient is a patient of color. There's a lot more at play. So I would definitely encourage you to check out what Kimberly Seals-Allers is doing. And I love her perspective because she, first and foremost, is a journalist. So what she does is uncover what is going on and get down on the ground level with women across the United States, understand what's going on. And with these ratings, with this Yelp-ish thing, this app, right? The ratings are, she digs into what's actually happening on the ground level, patient to provider. It's not just, did you have a good experience or not? Because when she dug a little further than that, women are saying that their qualification for having a good experience was that they survived childbirth. That was their qualification of, I had a good childbirth experience, was they got out alive. And that's not okay. So her research digs a little bit further into that, and I definitely recommend looking into it.
Thank you, Miranda. I know, Christina, you were talking about, educating from the top level, especially from the board level, and what kind of data is being collected there. Can you just elaborate a little bit on what you think could be some of these issues?
Right. So for probably like almost 6 years now, I've definitely been like, I wish that there would be a consumer medical board or like consumer oversight. I do think that the medical field gets very narrow. Like I went through some of that training when I was pre-health, pre-2014, and it becomes very narrow in that they really start to think just in like, it's just like a scientific way, or just like following the system that they've trained to do and memorization, but without oversight, such as people like us or normal people outside of healthcare trained to be in that rigorous memorization, go with the status quo view, because that's how you move up, is by just doing what you're told. That would probably solve these issues that we see, like over 400,000 people die a year from medical mistakes. And there's a lot of horrible things that go on in hospitals that people don't see because they don't have this oversight of humanitarian thinking people going in there and overseeing what they're doing and studying the results and being that oversight. They're not allowing non-medically trained people in there to evaluate how it's affecting people. And I think that could change.
Yeah, thank you so much for bringing that point. I also wanted to, I was training close to 200 nurses in California Association last month, and I got the opportunity to talk to a lot of them, and especially doctors, and they are really there to help. And I found that I looked at the curriculum as well, how they are being taught in schools and colleges. And I've started speaking to them because they need to know that trans folks, the issues on the trans side is much more, it's a topic by itself, but I think the medical community is willing to change when you put those policies or when you put those ideas at a much early level, especially when you're in the training process as a nurse. You're much more willing to learn, and as a doctor, you're much more willing to learn and take away all those unconscious biases that you might have come with. But it's very difficult to change doctors who are, I would say, much older in age. For instance, I called my cousin and I asked her, do you know the term gender dysphoria? And she's actually treating a trans patient today, but she doesn't know the terminology gender dysphoria. And I had to explain it to her, and she said, wow, thank you for teaching me this one. And I said, you're having a trans patient and you didn't know about it. She said, no, the reason is, and I told her, can you help your board, your hospital, have some training so that they can really understand how empathetic they can be. It's just that some of these are not even discussed in the curriculum. I think that is one thing, and especially I have been my doctor is a person of color, and when I came out to my doctor that I have some gender issues, my doctor couldn't understand. He never understood what I was going through, and he referred me to another psychiatrist. So there are lots of times, sometimes it's not about color or race, it's about the fragment of understanding, basic understanding they don't have about certain minorities. It's because they've not given emphasis. The other thing that I would also talk about is when you look at the healthcare system in US, I work with a lot of payer side industry too. So it's not just about payers and providers, it's about the patients, providers, drug industry, and also the policymakers. All three. If you want to make a change, especially the doctors have to be in the policy level discussions even at the Supreme Court level. They need to know why certain elements are, mental health issues so important, PTSD is important, autism is important, gender dysphoria is important, so that they would bring those changes at the top level and they can influence all the entire ecosystem of healthcare. But what we are talking about today is so important, and I really, really love this conversation. I wish we had more time to talk. We are running out of time. Joseph, do you want to bring up certain points? I see a lot of discussions here. I know you were mentioning something, Joseph.
Yeah, I think I would like to see women not only think about women issues, but to include other issues so that you will reflect things like what my fellow country lady said, Ngozi, that if we listen to more stories, or rather the more stories we listen to, the better we are able to grasp these issues and better able to solve them. Because I think, like I had always said, we have systemic problems. And if you just focus on the gender issue, those who want to impede the success of the gender issue that you are raising would actually be empowered or emboldened because they will see it from a single issue. Whereas if you're able to couple all these issues and fight in context of social justice, equity for all, you probably will have much more support. I hear people talk about men. Yes, men should know these things. I can't even get off my head the idea that senators, well-informed people who should know better, would have meeting about women without having their story included or incorporated in what they were discussing. So I think that's what I would add for whatever it is. And if any of you could address it, I'll be pleased to hear you.
I think you're right, because Crenshaw's work on intersectionality of a person, right? A person I don't just bring my identity as a woman. I don't just bring my identity as a Black female. There's so many intersectionalities to all of us. So I do believe that it's true that when we're up here fighting a good fight to reconstruct or dismantle and whatever you would like to call it, that if we're focusing on all the issues, because they're all intersected. It's not just about the female healthcare, right? Or the Black female healthcare. It's so many other things tied into that. And it's hard, right? Then it's hard because it's all entangled too. So which point do you start at? Because we could go down a rabbit hole, and if we want to move the work forward, we have to concentrate on something too.
Yeah.
I would agree and say that when we start to have people understand how they fit into the overall puzzle, because if we talk about women and we say women's issues, we're still doing an us and them, right? Because if you're not a woman or don't identify as female or a woman, then you're them and you're not us, right? And so in order to get past that us and them, you have to find ways through conversation, right, to find layers that identify people not just by how they seem and what they look like in the world, but how they interact with other people. So for example, if we're talking about women's health and we say, okay, women's health is important to women. Well, women's health is important to women, but when women's mortality affects everyone, right? So because if a woman dies, that woman was someone's sister, someone's mother, someone's daughter, someone's wife, right? And so all those other people now have a story about this person who happened to be female passing away because maybe some health equity issue, right? So we have to start to pull those strings and find where people are connected and how they're connected and speak to them in ways that are important to them. Because one of the things, no matter what the ism is, one of the things that we cannot forget is that if you're raising your flag and you're picketing about your thing is important to you. What makes it, the change happens when your thing is important to someone else. And so it is what it is, right? So you can be very, very upset and very adamant about something, but until other people share the importance, it's not going to go anywhere. So you have to find ways to show people that they are connected and the things that are important to you are important to them and how.
I think Mike is bringing in a very great point about, education system. Who is doing that? The question Mike is asking is, who is doing all this? Who is the person, educating the younger generation? Who is the person that is giving the awareness about the systemic problems we have? Who is the person in authority conducting this educational processes? So I think it is so important for us to think about who, and if the who is not doing the job, then we become the who. And sometimes what happens is, if we don't see our school system, like Future Kane was mentioning about it, when you don't see that in your school system, then you take it upon yourself to change the process. And Future Kane was mentioning, but I just want to hear from all of you, especially when you don't see the who of these organizations doing or creating a change or bringing even an education, then how do we change it? Or who are that who? How do we make sure the right person is there to bring in those changes and bring in that empathy, bring in those social media platforms, bring in that awareness, right from treating your bodies right to the the education system across the community and across the country today?
Okay, when you say who, Mike, guess what I'm going to say? You. Okay? And I'm not just pointing the finger at you, right? I'm pointing the finger at every single person on the screen. And I say that, hey, I say that we're helping you. That's who we're helping, okay? We're in this game to help you. Mm-hmm. And the reality is that it's all of us, right? Because hypothetically speaking, Miranda might say, well, my school district or my children go, they're not talking about the self-awareness and for children to be able to have the right to maybe learn about sex education, right? And acceptance of that and the medical field. Then Miranda should be advocating for that at her school. Mike, if you feel that social emotional learning and the mental health and race is a huge part, then it's up to us to ask and be in the know of our school districts. We pay taxes, right? And we pay taxes to schools that our children are going to. So we have the right to understand and to know. So it takes questions. And if you don't like it, you have to be the change that you want to see. Now, do I think it's the school's responsibility? I do. But I also know the reality. In the United States, 80% of our educators are female and white. I will repeat that again. 80% are female and white. We have an issue with race. We see it in all data. We see it in academics. We see it in discipline. We see it in jails. So we have to educate the people who are there, who should be dismantling racism, but are, as we see, inflicting trauma and maybe don't know and are upholding white supremacy and racism in our schools. So the who is, you may have to be vulnerable and say, I'm going to have a courageous conversation with my administration where my kids go, because it's that important to me. We can't wait anymore. We can't wait. So the who starts with you, the who starts with me, the who starts with every single one of us sitting here of what we believe our schools need to have. Why we can't wait is right. I can't wait. I'm 43 years tired and I'll keep saying that.
Yeah, thank you so much, Future. I wanted to make one point, especially when my daughter was 15 years old. When I came out, she found out that her father, that's me, is trans. And she told she came out and said, "Dad, why are you wearing a sari?" And my wife told me, don't tell her. And she caught hold of my hand and quietly said, tell her it's a Halloween or something. And I was really upset because my wife came from a very conservative background and we are Asian Indians. And I know where she came from and she didn't want to. And I told my wife that day that if I don't tell her about my problems, my issues, she's going to hear from someone else and it's not going to be right. I took 2 days and I told my daughter everything about me. And what I found was in 25 minutes, she got it. And my wife took 17 years to even realize that her husband is different. But it took a long time. And I sometimes feel that if we don't educate, it took 17 years for me to educate my wife, but it took 25 minutes to educate my daughter. And it is okay. And I now educate the entire community, and I'm also educating across the country in India as well. But as you said, Mike, and I know, I think if we in this panel, if you, four of you, and all of us in this panel, if we don't just create our own bubbles of education, I don't think we can wait for anyone else to come and tell us this is how you do it. Having said that, I just wanted to hear from Christina as well. She had mentioned about a few important things about the media and also, certain good points that you mentioned, Christina.
Right. I think it's important to be like egalitarian more in thinking. So empowering like victims or other people to higher levels. And so then that allows more people to provide their perspectives and to change at the innovative level at the higher levels, because we see this everywhere across the board where there's this huge power distance between who's making decisions and then who's it's affecting. And so we don't even see the victims, like they have no voice. They're just like they're like underneath them. And I think that's really needs to change. Then I also understand the issue about the demographics of teaching, because only 1 out of 6 teachers in my MBA program were women, and I almost felt like, dropping out because it was just so terrible, even though there were more women as students, which they always refer to in these statistics. What happens, like who's teaching it at the authority level, and then also what happens in the workforce is very different for people. So it's definitely important to give a voice to people and to look at it as a more egalitarian way where people should have the same rights and opportunities, and like they're seen as equal, not as like different variances based off who they are demographically or their statuses.
This conversation is very
obviously,
I'm sorry, someone was saying something?
Oh, and then also with the media, of course, we see that a lot of issues. I was just sent a dissertation about domestic violence portrayals in the media, and they often would blame the women for dying, like instigating it. And so that was an issue in 2014 or 2013. But now with social media, it's even worse. And then the tech companies don't have anti-discrimination laws or equality acts or anything like that. So based off the US headquarters. And so it just makes it even worse, where people get silenced on the internet and then everyone looks like we're all the same. Like we're just hating all this one person from across the world. And it's not like that, because if you asked in person, or if you went to like let's say you compared Europe or the United States, they're going to be very different in how they react to a situation based off what they've been taught. Like I've looked at the European Parliament, and they have all these different colors on the floor because they're trying to be integrated and inclusive. But then the United States, we're taught to be like suspicious of that, or being open and don't know, they have a huge power distance between who makes decisions, and that harms public safety and even just communication.
Thank you, Christina. I think, we are running out of time. This discussion is amazing. You all can get in touch with Christina, Future, Malika, and Miranda on LinkedIn. I wanted our founder, Joseph, to conclude. And Joseph had some points. And after Joseph is finished, we will be closing the call. But if you have any closing questions, what you could do is maybe you can get in touch with the panelists directly, and they are on LinkedIn. And if the panelists want to share some of your data, your link or your email, so some of our folks can get in touch. Robert, I think you're unmuted for some reason. Is there anything you want to say? Sure, please go ahead.
Yes, before we get to Joseph's concluding comments, I just want to thank everyone who has been on this call today, everyone who's participated, everyone who's just watched. Thank you, Joseph, for inviting me. Thank you, Celia, for moderating. Thank you, Karen and Mike, for getting involved. And a special thank you to the panel, Christina, Future, Miranda, and Malika, for sharing your powerful stories and opinions. You are all impressive change makers and leaders in your own fields, and I'm very impressed, and I have learned a lot from you, and I'm very grateful for your time today.
Thank you, Robert. Joseph, do you want to say a few words before we close?
Right. I completely agree with most of the points you made. I wanted to just go back to education, being an educational specialist who tend to focus on issues of curriculum and instruction. I don't know how many of you are aware of the fact that our so-called well-trained teachers, some of them will go to the classroom the first day. They determine who will succeed and who will not succeed based on the students' skin pigmentation. This is a reality, and I don't blame those people who do this. I blame the infrastructure that help them to cultivate the habit of the mind that propel them to behave the way they behave. That's another way to say it's incumbent upon the teaching professionals to understand the mess they make by perpetuating that system, and it continues. And one professional, I really love his work, Michael Apple from Wisconsin University. He usually asks the question, whose curriculum, whose culture, who makes the decision, who does all these things? Then I take it back to my country lady, Ngozi, who talked about the importance of using multiple stories instead of our default single story in making decisions. From all you have said, it's clear that if people will listen, if people will learn what they don't know, but inadvertently make decisions based on the little they know, which is the danger of that single story, we will be better. And I salute all of you. I know that the work we are doing is not it's not sexy job. It's not a job everybody tend to rush into. It's a difficult job. It's a job that drains your emotion when you see pain and anguish by the victims. So I urge you to continue the good work. The other thing I want to say though is that we are developing educational program, and this educational program will involve people around the world. We provide a platform for people around the world to be able to share their own stories. I have someone in Australia who is championing it over there, and he is part of the program we're trying to develop. There will be debates, there will be discussions, there will be sharing ideas as we move forward. The intent is to train the people of the world on the importance of multiple stories. Thank you.
Thank you, Joseph. We will be concluding right now, and you can get in touch with the panelists. They are on LinkedIn. And thank you so much for contributing to the conversation, for the learning. I was just moderating the question and answers. Joseph was moderating the panel. Thank you so much and have a wonderful day. And let's all continue to do and make changes from our end, right from our homes to the community and into the country and across the world. Thank you.
And whatever question you may have or ideas you think that could help us to continue to move forward, please do not hesitate to forward that to me or Celia, or now we have a website where we can all share ideas and present different things you do in case somebody needs to connect with you for the work you do. So on that note, thank you very much and your patience for doing a little bit over time.
I'll see you on the other side. All right.